Are you a CPAP user but are struggling to keep the mask on or even sleep with it at night? I'm Dr. Val, an innovative sleep medicine physician and women's sleep expert, here to give you a couple tips on what to do if you're struggling with your mask. So, I myself am a CPAP user, and it really was so difficult to get used to having something on my face to sleep at night. In general, I don't like to have a lot of things on my body. I typically don't wear a watch or my ring or even jewelry because I don't like that sensation of things on my body. And especially at night when I'm trying to fall asleep, it was so hard to get used to having something on my face. But what did I do, right? Because this is my job. I help people pretty much every day get on a CPAP machine to treat their obstructive sleep apnea. And there certainly are tips that you can use. So, number one is to find a mask that is comfortable for you. And it really is important to work with a good medical supply company because honestly, I think the mask is a make or break. For me personally, I tried about 5 to 6 different masks before I found one that really worked. The one that I love and I always recommend it to a lot of my patients is actually called the ResMed N30 mask. Not sponsored by ResMed, but I just really like this. And again, right, I tried so many different masks. I actually was listening on a podcast and they said that there was over 200 masks available. So even if you've tried 10, please don't give up. There are more masks available that could potentially work good for you. What I like about this specific mask is that it's really not too invasive. Typically, when you think about masks, maybe you think of like Bane or Darth Vader, and they're huge masks that cover your mouth like this. I mean, for someone like myself that doesn't like anything on their body, that would be really difficult to use. But I do have a lot of patients who use it and like it because they're also mouth breathers. And if your mouth is falling open, you do really need to keep that closed either with a full face mask that covers your nose and your mouth. There are smaller versions of a full face mask that just sit underneath your nose. They call them like a nasal cradle and it covers your mouth. Yeah, so that is certainly an option. Another option is to use a nasal mask. There's different types of nasal masks. Some go over the nose, some go underneath the nose, like my favorite mask. But if you're a mouth breather, it may not be as beneficial. So options for that are, yes, using the full face mask or getting a chin strap that keeps your mouth shut. Another option is maybe putting a little bit of lip tape to keep your mouth closed. But sometimes I would say your mouth and your jaw can just really relax, and regardless of what's taping your lips closed, it can open again. For maybe other folks who don't like the full face mask or nose mask, there is another style that's called the nasal pillows. I don't have an example here, but it's similar to this and it has a nasal prongs that fit inside your nose. Also, it's pretty lightweight. A lot of people find it really helpful. I didn't find it helpful because the edges are really sharp and it can tape the tip of my nose. And also, I feel like it didn't stay on really well if I did sleep on my side or toss and turn. And that's something to be mindful of. If you're a type of person that moves around a lot in your sleep, having a sort of a smaller mask like this with just one strap may not be as helpful. There are other straps, headgears that have different straps on the top of your head or even on the side. And there's also other styles of masks. This one, the hose comes out the front, where the hose comes off the head. When you have a mask where the hose comes off the head, it can be really helpful for someone who moves around a lot because then the hose will swivel and then the longer hose will swivel up here rather than around your body. Because after you connect the longer hose to your mask, it's 6 feet long. And so if you're tossing and turning, sometimes I've had patients just get really tangled up. Another option for that, and this isn't a specific mask, you can actually go and buy a CPAP hose holder. And it looks sort of like an IV pole, or you can get like a really large man hook and put the hook on your wall so that the hose moves more on the side of your wall and above your bed rather than around your body. Yeah, so when it comes to mask selection, if the first one you get from your medical supply company you don't like, ask for another one. Typically, they do give you a free mask within the first 30 days. If not, maybe ask your physician's office if they have any samples, or, you can buy them online. But yeah, please don't give up. There are so many different mask options available. There are even some companies that can make you a custom mask by doing sort of like a facial recognition software and then printing you a custom made cushion. That is amazing. I don't have access to that at the moment, but I think definitely as technology improves, that may be something to look into because we all have different shapes and sizes, and it's really hard just to sort of pick something off the rack, right? And then wear it. So coming down in the future, probably a custom made mask is helpful, but yes, find a mask that works for you. And another thing to think about, if you're having a hard time, maybe you have already found a mask that's comfortable, but you can't keep it on. Well, I always say, wear it while you're watching TV or playing on your phone. It is indicated when you're asleep, but this is just a nice way to desensitize yourself to it. And then start slow, 5-10 minutes a day. Work up to a half an hour and then try it at night. Because I think the worst time to try something new is when it's dark, it's quiet, and then you have something on your face and you're just alone with your thoughts listening to the machine, which is actually pretty quiet, but it's blowing so much air in. So little tips that can help you get more comfortable to using your CPAP machine. I hope you found this video helpful. Please subscribe to learn more about women's sleep health topics. Thanks.